let me give you guys, let's change the scenario and see what happens. How are you going to make a decision on your sequencing? Let me erase this and let me give you now a different scenario. So your different scenario is here, okay? Patient suffers a STEMI on May 1st. Okay. While in the hospital, patient had another STEMI, while in the hospital, patient had another STEMI 10 days from the initial MI. Okay, I don't know if that's possible, but let's just give it a try, guys. I mean, it can happen. Well, patient's still in the hospital, and yes, Karen, what is after 4 weeks? Let's talk about that. But let's look at the scenario first and tell me, guys, how are you going to decide on your sequencing this time? So what are the codes you guys need here? Let me see. What codes you guys need here? You have the I-21.34 initial STEMI, correct? You have that. Now for subsequent STEMI, what is the code for subsequent STEMI? Again, go to infarction, go to myocardium, and then subsequent STEMI. What do you guys have? Or I think myocardium, and then go to STEMI, then subsequent. Let me see what you guys get. I think it's also an I-22, but instead of I-22.9, something I-22.2, or I'm not so sure. But let me see, guys. What do you guys get? Oh, still I-22.9? Okay, still says I-22.9. All right, so we have both I-21.3 and I-22.9. So both of them are, I mean, whether STEMI or non-STEMI, STEMI or acute MI unspecified, you have the same subsequent MI code here. Tell me now, guys, what do you guys do? What is the correct sequencing here? Should we follow this one right here, or should we follow this sequencing here? So Brittany says now it's going to be I-21.3 and I-22.9. You guys agree with Brittany's answer? Yeah. I totally agree, because the reason why patient is in the hospital for the first place, guys, is the initial STEMI, right? Patient hasn't been discharged yet. Patient's still in the hospital. So the reason why patient is in the hospital is the first MI. And for that, your primary diagnosis should remain the initial MI. You guys get now what we're trying to do here? The reason why I keep emphasizing on the sequencing, guys, because in the AHIMA exam, it is, oh, I always mention this. It's a big of a deal, guys. Truly, it's really a huge deal that you guys understand what a sequencing is. Because, in the real world, the sequencing, the primary diagnosis has a lot to do with the reimbursement. And this is the primary or main reason why AHIMA is very particular with the primary diagnosis, because the reimbursement actually relies on your hands, coders. If you code it incorrectly, there's going to be some, the claims might not will be impacted. The claims will be affected. But sometimes the claims will probably get rejected or denied because of wrong sequencing. So that's the reason why you really got to understand this. Any question before we go to the next slide? I guess that's clear, right? Just remember, guys, if a patient has not been discharged and the MI the MI appeared within the 4-week time frame, you still code the initial MI, but that should be your primary diagnosis. The subsequent MI is going to be your secondary diagnosis, because that occurred after the patient was admitted. In this case, in this particular scenario, like 10 days ago, that's the reason why patient was in the hospital. And whatever that occurs, or an MI that occurs after that, as long as it is within the 4-week time frame, you code it as secondary. Okay. But if a patient was discharged initially and got readmitted, the second MI now is going to be your principal diagnosis, because this time the reason why patient was readmitted in the hospital is the second occurrence or the second MI. So far, so good. Now, I don't really expect you guys to memorize that in one sitting. You got to read it over and over again. Kristen, what about if third one occurs while still in the hospital? I guess there's still subsequent, although it's very rare within the 4-week time frame that a third MI should occur, because the second MI should alert the doctors. They need to clear, the arteries. They need to treat that. I have not heard about it yet, but it may occur. But you still have to code it as a subsequent. If I know it's going to be brutal if a patient suffers for a third heart attack while in confinement. The second one should really alarm all the doctors, the cardiologists, that, hey, we need to really clean it up. It's our bad here. Now, I want to go back to Karen's question. What about an MI that occurred after 4 weeks? Okay, let me erase this narrative here, and let's see if the second MI happened after 4 weeks. Let's go back to the guidelines. Let's see here. For encounters after 4-week time frame. Okay, so you guys see this? And the patient still receiving care related to the myocardial infarction, the appropriate aftercare code should be assigned, and rather a code from category I-21 for old or healed myocardial infarctions not requiring further care. Code I-25.2, old myocardial infarction, may be assigned. Okay. Now here's what's going to happen, guys. Okay. I have actually simplified here. Category code I-21 is for the initial MI. This is the first occurrence and reoccurrence after 4 weeks. Okay. So look here, guys. First occurrence and reoccurrence after 4 weeks. That means to say, after 4 weeks, if a patient suffers with another heart attack, that's going to be considered as, again, initial MI. What happened to, the category code you are going to use is I-21. Now, what happened to the first one that have occurred more than 4 weeks ago? You are going to code it as this one here, old MI. Does that make sense? So you, after 4 weeks of reoccurrence, guys, what are you gonna do? You are to assign again an initial MI code or a fresh MI code, which is I-21. What I mean, depending on what you know, what heart muscle is affected, your characters after the decimal will vary. But the old MI is now going to be coded as I-25.2. Okay. Now, Kristen is saying, just for example, though, do you use I-22.9 twice, or is there a different code? There's no other code, Christine, for subsequent MI, but just I-22.9. The guidelines doesn't mention any or other subsequent MI code. It is still I-22.9. Okay. Now, do you guys get what we're trying to do here? What does the guideline say here? Let me go back to the board and see how am I going to illustrate this old MI. Okay, so the first one, your category code is I-21, correct? Your subsequent, this is your second, is I-22. And remember, it has to be within the 4-week time frame. Now, past 4 weeks, if there is reoccurrence, how do you guys do that now? This one right here becomes I-25.2 because it becomes an old MI. This one here becomes another new MI. Now, is this clear, guys? The first one becomes old I-25.2 after 4 weeks. The fresh one, the new MI, is going to be coded like it was an initial MI.